Congestive heart failure, or CHF, is a serious condition. It affects the heart's ability to pump blood effectively. In CHF, the heart weakens and can't keep up with the body's demands. This doesn't mean the heart stops beating entirely. Instead, it means the heart can't pump with enough force. This leads to a buildup of blood and fluid in the body, causing a range of symptoms. CHF is a chronic condition that often gets worse over time. However, with proper treatment and lifestyle changes, people with CHF can live full and active lives. Early diagnosis and treatment are key to managing CHF. It's important to understand CHF and its implications. This knowledge empowers individuals to take control of their health. Imagine your heart as a shipping department. Its job is to package and send out blood. This blood, like packages, carries essential supplies to the body's cells. In a healthy heart, the shipping department runs smoothly. Packages are sent out efficiently. Every cell receives its supplies on time. Now imagine the shipping department is understaffed. The workers are tired and can't keep up with the demand. Packages start piling up, and deliveries are delayed. This is similar to what happens in heart failure. The weakened heart struggles to pump blood effectively, leading to fluid congestion. This congestion primarily affects the lungs and the rest of the body. Just as a backed-up shipping department can disrupt business, heart failure can disrupt the body's normal function. Congestive heart failure, or CHF, isn't a one-size-fits-all condition. It manifests in different ways depending on which part of the heart is affected. There are three main types: left-sided, right-sided, and high-output heart failure. Left-sided CHF is the most common type. It occurs when the left ventricle, the heart's main pumping chamber, weakens. This weakens the heart's ability to pump oxygen-rich blood from the lungs to the rest of the body. As a result, blood can back up into the lungs, causing shortness of breath. Right-sided CHF happens when the right ventricle struggles to pump blood to the lungs. This often results from left-sided CHF, leading to fluid buildup in the legs, ankles, and abdomen. High-output heart failure is less common and occurs when the heart pumps more blood than usual, but still can't meet the body's needs. Understanding the different types of CHF is crucial for accurate diagnosis and effective treatment. Each type presents unique challenges and requires tailored management strategies. Congestive heart failure, or CHF, is a widespread health concern, affecting millions worldwide. In the United States alone, approximately 6.2 million adults live with heart failure. The prevalence of CHF increases with age and is a leading cause of hospitalization in people over 65. This growing prevalence is attributed to an aging population and increasing risk factors like high blood pressure, coronary artery disease, and diabetes. These conditions can damage the heart muscle over time, leading to CHF. The impact of CHF extends beyond individual health, posing a significant economic burden on healthcare systems globally. Symptoms like fatigue, shortness of breath, and swelling can limit daily activities and reduce overall well-being. Addressing CHF is crucial for improving individual health outcomes and mitigating its broader societal impact. Section 5. Recognizing the symptoms of CHF. Recognizing the symptoms of congestive heart failure, or CHF, is crucial for early diagnosis and timely intervention. One of the most common symptoms is shortness of breath, especially during physical activity or when lying down. Another telltale sign is edema, or swelling, typically in the legs, ankles, and feet. As fluid accumulates, it can also lead to rapid weight gain, often a sign that CHF is worsening. Other symptoms include persistent coughing or wheezing, fatigue and weakness, a rapid or irregular heartbeat, and loss of appetite or nausea. It's important to note that these symptoms can vary from person to person and may not all be present in every individual with CHF. Section 6. Unraveling the causes of congestive heart failure. Congestive heart failure, or CHF, is a complex condition with various underlying causes. One of the most common culprits is coronary artery disease, or CAD, which occurs when plaque builds up in the arteries that supply blood to the heart muscle. High blood pressure, or hypertension, is another major contributor. Other factors include valvular heart disease, cardiomyopathy, congenital heart defects, diabetes, and obesity. Identifying the underlying cause of CHF is crucial for determining the most effective treatment plan. Essentially, anything that damages the heart muscle or makes it work harder than it should can contribute to CHF development. Understanding these causes helps in tailoring appropriate treatment strategies. Section 7. Risk factors and complications. Recognizing the factors that can increase an individual's risk of developing CHF is crucial. Non-modifiable risk factors include age, family history, and race. Modifiable risk factors include high blood pressure, high cholesterol, diabetes, smoking, obesity, and physical inactivity. Untreated or poorly managed CHF can lead to serious complications, including kidney damage, liver damage, heart valve problems, and heart rhythm problems. Section 8. Stages of CHF and treatment options. Congestive heart failure, or CHF, progresses through stages, each characterized by the severity of symptoms and the heart's functional limitations. The New York Heart Association classification system outlines 4 stages of CHF. Stage A, high risk of developing CHF but no structural heart damage or symptoms. Focus on managing risk factors. Stage B, structural heart damage but no symptoms. Emphasis on preventing progression. Stage C, structural heart damage with symptoms. Treatment aims to manage symptoms and improve quality of life. Stage D, advanced stage with severe symptoms. Treatment options may include intravenous medications, heart transplantation, or mechanical circulatory support devices. Lifestyle modifications, including a heart-healthy diet and regular exercise, are crucial at all stages. Medications like ACE inhibitors, ARBs, beta blockers, and diuretics play a vital role in managing CHF. Tailoring treatment to the specific stage and individual patient factors is essential for effective management. Section 9. Diagnosing congestive heart failure. Diagnosing congestive heart failure involves a comprehensive evaluation of the patient's medical history, physical examination, and diagnostic tests. The process begins with a thorough review of the patient's symptoms, risk factors, and family history of heart disease. During the physical examination, the doctor will listen to the heart and lungs for any abnormalities and check for fluid retention. Further investigations may include an electrocardiogram, ECG, echocardiogram, chest X-ray, blood tests, and sometimes cardiac catheterization. Accurate diagnosis is paramount for tailoring an effective treatment plan. These diagnostic tools help determine the severity of CHF and guide treatment decisions. Section 10. Lifestyle modifications and medications for CHF management. Managing congestive heart failure often involves a multifaceted approach that includes both lifestyle modifications and medications. Dietary modifications. Adopting a heart-healthy diet low in sodium, saturated fat, and cholesterol is crucial. Fluid restriction. In some cases, doctors may recommend limiting fluid intake to prevent excessive fluid buildup. Regular exercise. Engaging in regular physical activity strengthens the heart muscle and improves overall fitness. Weight management. Losing even a small amount of weight can significantly reduce strain on the heart. Smoking cessation. Quitting smoking is one of the most beneficial things you can do for your heart health. Medications play a vital role in managing CHF symptoms, improving heart function, and reducing the risk of complications. Common medications prescribed for CHF include diuretics, ACE inhibitors, ARBs, beta blockers, and digoxin. The specific medications and dosages prescribed vary depending on the severity of CHF and individual patient factors. Adherence to the prescribed medication regimen is crucial for managing CHF effectively. Combining lifestyle changes with appropriate medications can significantly improve quality of life for CHF patients. Section 11. Living with CHF, tips for a fulfilling life. Receiving a diagnosis of congestive heart failure can be overwhelming, but with proper management, individuals with CHF can live full and meaningful lives. Adapting to life with CHF requires ongoing commitment and proactive self-care. Work closely with your healthcare team, attend regular checkups, and be proactive in asking questions about your condition and treatment plan. Creating a supportive environment is equally important. Share your diagnosis with family and friends, and don't hesitate to ask for help when needed. Support groups can provide valuable emotional support and practical advice. Incorporate these strategies into your daily routine. Weigh yourself daily, track your symptoms, stay active, eat a heart-healthy diet, and take your medications as prescribed. Get enough sleep. Aim for 7 to 8 hours of quality sleep each night. Remember, living with CHF is a journey, not a destination. Maintaining a positive outlook, staying connected with loved ones, and prioritizing self-care can make all the difference in living a full and rewarding life.